Hello, everyone. I'm Dr. Antoine Abu Musa, Chief Medical Officer at NOW-fertility, and it's my pleasure to welcome you to this special online interview. Today, I'm honored to have with me Ms. Tina Padia, a certified life coach and fertility coach. Ms. Padia brings extensive experience in supporting and guiding couples through their fertility journey, offering invaluable support during what can be a challenging time. Welcome, Tina. It's wonderful to have you with us today.
Thank you so much. Yeah, and thank you for having me. It's an honor.
As a start, can you please introduce yourself to our audience?
Yeah, sure. So as you already mentioned, I'm a fertility coach. So I'm a certified life coach and I specialize in fertility coaching. And it's really for me, it's the most, important thing is the emotional journey, the emotional and the mental trauma that you go through when you go through the IVF journey and the fertility journey. And so I focus on helping women, predominantly women, through this journey, help them navigate the journey, but also use all the tools and techniques that I have as a master practitioner of NLP. So NLP stands for Neuro Linguistics Programming, and essentially, it's how you can change your thoughts and rewire your brain so that you can start to think differently, have a different perspective and also learning self-compassion, so how you can be kinder to yourself on this journey. So that's my focus. I also am really huge believer in holistic therapy, so I'm a sound bowl
Mhm.
practitioner and I do Reiki energy healing. So for me it's like the science part in terms of the coaching because it's very much based on science, and then the holistic part, which is the energy healing and
Yeah.
the emotional blocks, and focusing on the lady as a whole. So that's kind of like my area of focus.
Okay, that's quite interesting. We all know that fertility journey, especially IVF treatment, is filled with a lot of emotions and stress. Could
Mm.
you please share with us how you first became involved in supporting women through the emotional challenges of IVF? How did it all start with you?
It all started with me with my own journey, really. So I started my IVF journey. We've been after routine fertility tests. My husband and I were told that that the chance of us conceiving naturally would be pretty much zero. So we were advised to start IVF treatment as soon as possible if we
Mhm.
had any chance, of us conceiving. And so we started our journey. And, I must say, I was really naive. I honestly thought that one cycle, I didn't know much, I didn't know much about what was gonna be involved and what was gonna come up for me. So I initially thought one cycle would be enough, one stimulation
Yeah.
cycle, one transfer, and we would be pregnant. And I was in for a huge shock because that wasn't my journey. My journey was 4 years, so 4 years of treatment, 4 years of cycles, unsuccessful transfers, surgery, complications in between, blood tests,
Yeah.
scans, a rheumatologist, an endocrinologist to help with my hormones. So there was so much going on in between, and the emotional trauma, the exhaustion mentally, really like surprised me. I wasn't ready for it. And so at that point, I decided to quit my job and
Mhm.
focus on becoming a coach. So I was actually training at the same time that I was going through my journey. So not knowing how my journey was, the outcome of my journey, I went on this other journey to help and support women like me that were going through it. Because for me, I felt incredibly lonely. Like the start of it was incredibly lonely. I didn't know what to expect. And that was really the start of my journey. So I wanted to help other women that were on this journey because I feel like, doctors are incredible. They're incredible on the biological side and giving you the treatment and
Mm.
helping you, um, I guess physically, but it's the emotional support that women really need alongside the physical treatment. Like they both have to go hand in hand. And so
Yeah,
that's
of
kind of
course.
what sparked this journey and this desire to help other women so that, for me, it was like I just didn't want anyone else to feel alone on this journey and to have that support from someone who gets it because they've gone through the journey, but also has the tools, the strategies, and the deep emotional kind of connection on how I can help other people through it.
Yeah, we know IVF journey is quite challenging, and there are a lot of emotions involved. But what are the most common emotional challenges that women face during IVF? And how do you help them and guide them in managing those feelings?
Yeah, I mean, like you just said, there's so many emotions that come up. It's such a triggering journey and it's traumatic. the anguish, the disappointment. I think, a lot of the emotions that women that I certainly coach, they talk about the uncertainty of the journey. So that's a big thing,
Yeah.
like not knowing what's going to happen, not knowing the outcome. As humans, we're hardwired to be in control. And when you're on this journey, a lot of it is out of your control, and that creates stress, the uncertainty of not knowing what's going to happen. That creates huge stress, anxiety for women that are going through it. Emotions such as guilt, shame, those sorts of feelings start to play and start to get bigger and bigger. And I also feel like a lot of blame. So, you end up blaming yourself, you end up blaming your body. And as you do all of, as you go through all of these different emotions, you end up feeling just incredibly lonely and
Mhm.
sad. And that's kind of like the emotional kind of ball that you get into when you go, emotional bubble, I would call it, that you enter when you go through this journey. So what I do, the way I work with these women that I coach, it's incredible women that I go on this journey, is, I use the tools that I've been taught and I've used on myself. So all the NLP tools, so tools such as reframing, for example. So when you're on this journey, it's always, or you always question yourself and you always kind of convince yourself that it's not going to work. This treatment, I don't feel pregnant. I don't think it's working. I don't think it's ever going to work for me. I don't think, my body is just not ready. My body is just not capable of getting pregnant. And so it's like reframing that kind of narrative and those stories that women are telling themselves. So I mean, reframing is essentially, how can you tell a different story? How can we reframe the situation into something more positive, into something more helpful, into something that's going to give you inner strength and resilience? So instead of saying this treatment's never going to work, you can reframe that to say, but what if this treatment does work? What if I
Yeah.
do get, my body is capable and I am ready, and the universe, I always call upon the universe, my body, I'm sending the signals and the messages that I desire. I want to be a mum. That's the most important thing for me, and I'm doing everything in my power to make that happen. So that's just an example, but really it's like coaching them through it, and it's about feeding your subconscious with the right words, the right narrative, the right stories, connecting the mind and body, because often when we go through this, we forget that our thoughts, our emotions, everything we're feeling ends up in our body somewhere, so the stress, the anxiety, sometimes like when you're on this, and I speak to women that are, just about to go through the transfer, for example, and they say, I feel this knot in my stomach and it's making me feel like nauseous. And that's a result of the stress and the anxieties that they're feeling that's manifesting in their body. So I help, I guess, talk them through what they're feeling, help them to actually acknowledge what they're feeling. So I say, look, it's okay to feel like this. It's normal. When you're on this journey,
Yeah.
there's so much that comes up. So allow yourself to feel the way you do, rather than pushing that feeling away or hiding it or pretending that everything's okay when really inside you're falling apart. So creating a really safe, nurturing space for them to be able to talk. And a lot of women that I coach say to me, I've never said this out loud to anyone. It's just in my head. I get into my head and I don't share how I'm really feeling, not with their friends, not with their partner. So it's about, letting them have that space where they can be open and they can talk honestly about what's going on for them.
Yeah, yeah, this is quite true. Well, you talked about uncertainties in IVF, and we know that there's a lot of uncertainties at every stage. And you
Yeah.
also talked about the negative vibes sometimes women start with when they join the fertility journey. So, how can women cope with the fear, anxiety, the negative vibes that they have, especially not knowing what the outcome will be of IVF?
Yeah, it's a really difficult one, because the uncertainty is what kills, it's really, I really understand, because for me that was one of the hardest things, like just not knowing, and always thinking ahead. So the first thing, honestly, I would say is talk to someone. So I myself had someone to help me. So I had a coach, and she helped support me
Mhm.
and my husband when we were going through it, because there's only so much you can help yourself and help your partner. Like sometimes it's always good to have someone external to come and help and really support you, so that you feel like you can really truly open up. So firstly, like speak to someone, whether it's a coach, a therapist, or someone, a psychologist, whatever you feel comfortable with. Because honestly, trying to do this alone is just incredibly hard. So that's kind of the first thing. But there are ways that you can help yourself as well. So look at ways of all I say is always looking ahead is hard, and that's what creates uncertainty. So do things that help you focus on the present and take it one day at a time. So things like doing meditation. So if you're not used to doing any holistic therapy, find someone that can help with, helping you. Just simple things like breathing techniques that help ground you and just help calm you and just help your body feel less anxious and safer and try and get you back into the present moment. So things like meditation, breathing techniques, the things that I mentioned, like the holistic stuff like acupuncture is also very helpful. Reiki healing. So some of these things, sound healing, some of these holistic things that you can look into to help yourself as well. The other things I would say is, start to journal or start to write stuff down that's really bothering you, or things that, you have these constant questions or thoughts that go on in our minds, and it's like a constant loop, and it's really hard to get out of that. So write some of this stuff down. I call it like a mind dump or a brain dump. So maybe before you go to sleep, take out a journal and such. Just, it doesn't even have to make sense. It's just could be words that you're thinking, things that are worrying you, and when you write it down, you almost, you see it and you realize, actually this isn't my reality. This isn't real. This is, this is what I'm telling myself. And also by taking it out of your mind, you're kind of creating space for more positive thoughts to take up. You're inviting more positive thoughts in your mind, and you're taking out all the things that aren't helping. So that's a really good one, like writing stuff down. I also, say, it does come down to what I can control and what I can't control. So I often say, like, let's make a list. On one side, let's put down all the things that are in your control and all the things that are out of your control. So by writing down the things that are out of your control, okay, those are things that we know we can't work on. So let's kind of move that aside and let's focus on all the things that we can control. So things like what you're saying to yourself, your own thoughts and your own behavior responses, how you're the words that you're using on yourself, really. So the self-compassion. So those are things that you can control. You can control the time and energy and focus that you give and prioritize to your own mental well-being by either speaking to someone or doing things that are going to help you, like talking about it, for example, talking about what's really going on for you. So, that's kind of ways that people can what they can do, I guess, to help themselves if they're not ready to speak to someone who's really going to be able to support them.
Yeah, of course. You mentioned that many times women undergoing IVF, they feel isolated and sometimes
Yeah.
misunderstood. So,
Mhm.
based on your experience, what do you think is the most significant emotional impact of IVF that people do not talk about? It's overlooked. They don't like to speak about it.
You know what? There's lots of different things at play here. So I'm based in Asia. So here, cultural nuances, have a huge impact. So typically in the Asian culture, you've got your extended family, and there's always that pressure to have a child. There's always that pressure. Okay, once you're married, what's next? Okay, now you're married. When are you having a baby? And it's those sort of questions and opinions and advice that people give you that really is triggering sometimes, because you don't want to tell everyone that you're struggling. You've been trying to conceive for the last few years. You're on fertility treatment. So it's that guilt and shame, feeling shamed about what you're going through. And I think it's still very much taboo in a lot of these countries to talk about fertility, because people don't understand it really. They don't know enough in terms of what a woman goes through when they're going through the fertility journey. So I think the shame, the guilt and the embarrassment is what stops people from talking about it and opening up. And also the sense that you feel like you're the only one. You feel like you're the only one on this journey, so that stops you from talking about it. So, just very recently I went to a networking event and I was very open about what I do in my journey. And a lady says to me, I've got one daughter and I had her through IVF and not many people know. And I'm talking to you because you understand and you've been through it. So, but not many people know that that's what happened. So, it's just so many couples out there or women out there just don't talk about it because they feel this guilt, this shame, this embarrassment, but also they feel like they don't have anyone to talk to about it.
Yeah, as you said, this is quite common in some Asian or in the Middle East culture.
Mm.
Uh, what do you tell women who have been doing IVF repeatedly with a lot of failures, and now they are afraid. They worry a lot about their future and about continuing their fertility journey. What's your advice to them?
So, this is something that I get a lot of with the ladies that I coach, because they generally women that have gone through multiple cycles, they've gone through lots of different challenges, and they've gone through lots of different frozen embryo transfers or fresh transfers that haven't worked out. So they get to that point where they're really desperate and they're really feeling like they can't, what direction do I go in? So when they come to me and I coach them through it, I don't ever tell anyone, I think you should look at other options or anything like that. That's not my job. My job is to help the ladies, the client that I'm working with, help themselves. So I ask them the questions, in terms of how they're feeling, and we get to a point where ultimately they decide. I always say, look, it's your body, it's your decision. Only you know when you're ready to look at other options, or if you still have that strength, resilience, and energy to continue on that journey, and what that would look like, what do you want to do differently. And it's really about the mindset. So it's shifting the mindset in terms of, okay, these are the things, again, it comes back to these are things that are in my control, and this is what I want to work on for the next cycle. So we always talk about, okay, what can you do? What do you want to do differently? A lot of my clients say, I don't want all the medication this time because I know it really affects me physically. So then it's about like, okay, advocating for yourself with the doctor and explaining that this is the way I want to do the next cycle. I've got the strength, I've got the support, I want to continue, but I want it to look very different. I don't want to be heavily medicated because I know how it makes me feel. So these are the sorts of conversations I have and the questions that I ask. And it's ultimately like we walk through that journey together.
Yeah, our experience and even the literature tells us that most women will drop out from treatment
Mm,
because of the stress of the journey itself.
yeah.
And those women who drop out, if they continue doing IVF, ultimately they will be able to get pregnant, most of them. So it's not only about doing the right medical job, as you said, but also we need to look at the patient in a holistic approach. We need to support the woman, not only medically explaining everything related to the injections, the pickup, and everything, but also to make sure that she is emotionally ready to continue and pursue her throughout the journey. So these patients, what is the experience? How do patients tell you after you sit with them and you coach them? What is the feedback that you get from your patients?
So a lot of my clients, when I coach them and we do the sessions, we do the programs. So mine it's a program that we go through, because one-off sessions don't work. It's a program that I develop. It's a framework, and we go through those. So it's 12 weeks of working together and hourly sessions with me, right? So we work on the program because there's lots of different things that I need to walk, talk them through and coach them through when they're on this journey. It's not so simple as saying, okay, you just got to change your thoughts and change your perspective. It's not that easy. You have to coach people in terms of how do you do that? How can I do that? And you're absolutely right. Like the support, the emotional mindset and the mind and body connection is just as important as the physical injections. Like the two have to be aligned. And I always say it's, the journey, like having a baby through IVF is not one thing or another. It's a lot of things combined and everything aligning together at the same time. And like you said, it's a holistic treatment. And so that's really what really works. And I think that's the feedback that I get. So a lot of my clients say, like, without your support, I wouldn't have gone through this journey. I probably would have stopped and just not continued, because I just didn't have the energy. I didn't have the resilience. I was feeling just broken. And so that's incredible for me, because I feel like I've been part of that journey. And, a couple of my clients that we've done that have actually got pregnant through doing that additional treatment because they felt like they really could. So, or there's, clients that want to go take a little bit of a break because they just feel like they need to recharge, and that's absolutely fine too. They go off, take a little bit of a break, and start treatment again because they feel stronger and they feel like they've got the support to be able to do multiple cycles, and not feel alone.
Yeah, yeah. Well, thank you very much. This was really very interesting interview. And as you know, many times doctors, they don't have time to spend with the patient to support them.
Oh,
So people
yeah.
like you who can give them all the support, all the necessary help that they need emotionally and so on is really needed. And I think this is very important. That's what we try to do at Now Fertility, in collaborating and being partners with ladies like you who can coach our patient also is really very, very important for us. Thank you very much.
Thank you so much, and it's an honor. Thank you for having me here tonight and talking about so passionately what I love doing. And I agree, it's so important. This supporting women alongside the doctors. I completely agree. The doctors don't have time. They focus on you guys focus on what you're really good at, and we focus on what we're good at. And the two of us combined will hopefully help support, many, many women on this journey.
Pleasure meeting you today.
You too. Thank you so much.